ಪ್ರಕರಣಗಳನ್ನು ಅತ್ಯಂತ ನಿಖರತೆ ಮತ್ತು ನಿಪುಣತೆಯೊಂದಿಗೆ ಕೈಗೊಳ್ಳುವಲ್ಲಿ ಮುಂಚೂಣಿಯಲ್ಲಿದೆ. ಸಂಸ್ಥೆಯನ್ನು 2004ರಲ್ಲಿ ನಿರ್ದೇಶಕರಾಗಿದ್ದ ಡಾ. ತಿಮ್ಮಪ್ಪ ಹೆಗ್ಡೆಯವರು ಆರಂಭಿಸಿದ್ದು ಭಾರತದ ಅಂದಿನ ರಾಷ್ಟ್ರಪತಿ ಡಾ. ಎ.ಪಿ.ಜೆ. ಅಬ್ದುಲ್ ಕಲಾಂ ಅವರು ಉದ್ಘಾಟಿಸಿದ್ದರು. 2 ದಶಕಗಳ ಯಶಸ್ವಿ ಪಯಣದ ಕುರಿತು ಪ್ರತಿಕ್ರಿಯಿಸಿದ ಪ್ರಧಾನ ಚಿಕಿತ್ಸಕ, ಕ್ಲಿನಿಕಲ್ ಲೀಡ್ ಮತ್ತು ಹಿರಿಯ ಸಮಾಲೋಚಕರಾದ ಡಾ. ಕೋಮಲ್ ಪ್ರಸಾದ್, ಕಳೆದ 2 ದಶಕಗಳಲ್ಲಿ ನಾರಾಯಣ ನರವಿಜ್ಞಾನ ಸಂಸ್ಥೆಯು ನರಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ಆರೈಕೆಯಲ್ಲಿ ಪ್ರಪ್ರಥಮವೆನಿಸುವಂತಹ ಸಾಧನೆ ಮಾಡಿದೆ. ಸ್ಥಾಪನೆಯಿಂದ ಇದುವರೆಗೆ ವರ್ಷಕ್ಕೆ ಸರಾಸರಿ 1,000 ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳನ್ನು ನಡೆಸಿದ್ದು, ದೇಶದಲ್ಲೇ ನಮ್ಮ ಸಂಸ್ಥೆಯು ಈ ಸಾಧನೆ ಮಾಡಿದ ಮೊಟ್ಟ-ಮೊದಲ ಸಂಸ್ಥೆ ಎಂಬ ಹೆಗ್ಗಳಿಕೆಗೆ ಪಾತ್ರವಾಗಿದೆ. ನ್ಯೂರೋ-ಆಂಕಾಲಜಿ, ಗ್ರಂಥಿ ನರವಿಜ್ಞಾನ, ಸ್ಕಲ್ ಬೇಸ್ ಸರ್ಜರಿ, ತಲೆ ಬುರುಡೆ ತಳಭಾಗದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಎಂಡೋಸ್ಕೋಪಿಕ್ ಸರ್ಜರಿ, ಮೂರ್ಛೆ ರೋಗ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಫಂಕ್ಷನಲ್ ನ್ಯೂರೋ-ಸರ್ಜರಿ ಮತ್ತು ಕನಿಷ್ಠ ಸೀಳುವಿಕೆಯ, ಗಾಯದ, ಬೆನ್ನುಮೂಳೆಯ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ವಿಭಾಗಗಳಲ್ಲಿ ನಮ್ಮ ತಂಡ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳನ್ನು ನಡೆಸಿದೆ. ತಂತ್ರಜ್ಞಾನದ ಮೇಲಿನ ವಿಶೇಷ ಗಮನ, ವೃತ್ತಿಪರ ಮತ್ತು ಚಿಕಿತ್ಸಾ ಉತ್ಕೃಷ್ಟತೆ ಮತ್ತು ರೋಗಿಗೆ ಮೊದಲ ಆದ್ಯತೆಯೊಂದಿಗೆ ಸಂಸ್ಥೆಯ ವ್ಯಾಪಕವಾದ ಸಾಮರ್ಥ್ಯವು ನರವಿಜ್ಞಾನದಲ್ಲಿ ಉತ್ಕೃಷ್ಟ ಸಂಸ್ಥೆಯಾಗಿ ಹೊರಹೊಮ್ಮುವಂತೆ ಮಾಡಿದೆ ಎನ್ನುತ್ತಾರೆ. ಸಂಸ್ಥೆಯು ಗಮನ ಕೇಂದ್ರೀಕರಿಸಿರುವ ಪ್ರಮುಖ ವಿಭಾಗವಾದ ಬೆನ್ನು ಮೂಳೆ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯು ಕ್ಷೀಣಿಸುವ ಮೂಳೆಗಳ ರೋಗದಿಂದ ಬೆನ್ನು ಮೂಳೆ ಗಡ್ಡೆಗಳವರೆಗೆ ಮತ್ತು ಅಪಘಾತ ಸಂಬಂಧಿ ಗಾಯಗಳ ಚಿಕಿತ್ಸೆವರೆಗೆ ವಿಸ್ತರಿಸಿದೆ. ರೋಬೋಟ್ ನೆರವಿನ ಬೆನ್ನುಮೂಳೆ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯು ಹೊಸ ಸೇರ್ಪಡೆಯಾಗಿರುವ ಅತ್ಯಾಧುನಿಕ ಸುಧಾರಿತ ತಂತ್ರಜ್ಞಾನವಾಗಿದ್ದು, ನಿಖರತೆ ಮತ್ತು ಖಚಿತತೆಯನ್ನು ಇನ್ನಷ್ಟು ಹೆಚ್ಚಿಸುತ್ತದೆ. ಮಕ್ಕಳಲ್ಲಿನ ನರಸಂಬಂಧಿ ಸ್ಥಿತಿ ನ್ಯೂನತೆಗಳನ್ನು ಪರಿಹರಿಸುವ ಮಕ್ಕಳ ನರಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯು, ಹುಟ್ಟಿನಿಂದಲೇ ಬರುವ ಮೆದುಳಿನ ವಿಕೃತಿಗಳು ಮತ್ತು ಗಡ್ಡೆಗಳ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯು ಸಂಸ್ಥೆಯು ಉತ್ಕೃಷ್ಟತಾ ಕೇಂದ್ರವಾಗಿ ಹೊರಹೊಮ್ಮುವಂತೆ ಮಾಡಿದೆ.
Facilities. How is the Narayana Health is planning to take it to rural area, whether it is affordable?
Yeah, so both are very important questions. So those are the points where we stress, and most of our patients are from rural background, and also there are ways in which it's made affordable to reach each and every person, because these are new technology available. We can't take this technology to the footsteps, but indirectly we do this using telecommunication, outreach clinics, from where these people who require this advanced technology are brought to our center, and that's how we make it available.
Okay, so now majority of the government of India is trying to spend crores and crores on the healthcare. Are you now in any way connecting with government of India? So they pay you and you take this to rural, bring people, any communication mode, preventive healthcare?
Yeah, that's always there, right from its inception. We are the pioneers in the micro-insurance schemes, and from those days we are following it up, and whenever the new scheme comes, it's made available.
Okay, so Peter, in this case, performing a surgery on a child, how difficult and how challenging it is?
Definitely, operating on small children is very challenging. One of the most difficult things is because the children have very little blood in them. So even a small amount of blood loss can be seriously life-threatening. So the aim is to do it slowly, carefully, so that minimum amount of damage happens and the child is safe. More than that, I would also, answering your previous question about cost.
Yes, sir.
With children, it is very, very critical, because often what happens, these small babies, they will have young families. The families are just beginning. Their income is very little. So even a middle income person may not be able to afford these things. And looking after children is the responsibility of the entire city or the community. So there is an African saying that it takes a village to take care of a child. So all of us have to take part in bringing these children to safety. Whenever the family lands in trouble with a small child who is ill, we have to all contribute to that. You may often see requests for help, and whoever can do whatever small amount of help, that will be important to save a child. So that is, I think, very important. The community has to come together to save these children, because it can be done technically, but that needs some financial support also from the community.
So do you have Narayana Health out of India as well? Or the patients come from abroad to India?
People do come. A lot of children come from abroad also, and we have been helping those children also, and quite successfully too. Africa, Malaysia, Southeast Asia, many children have been coming.
Whenever you come to Narayana Hridayalaya, you will see most of our patients are really poor. They are really, really poor. Many of them come from rural Karnataka. Fortunately, there are various government schemes for BPL patients. And if you ask them, most of them don't have to pay anything.
Okay.
So because of these schemes, we are able to offer the best of healthcare to really, really poor people. Additionally, we get a lot of patients from Bangladesh. Bangladesh has been one country where we get so many patients. And even all of them, they are also very poor. The beauty of this hospital, and this is the vision of Dr. Devi Shetty, when they come to our hospital, within whatever budget they have, and we have a system, somehow they are able to, manage the cost, and patients are not refused treatment just because of their inability to pay. And that vision has been working for us.
Okay. Kumar sir, last question.
You had mentioned about other places where Narayana has. We are in more than 20 places around India. So I was fortunate to start a unit in Mysore, the Neuro-surgeries, same kind of facility to answer your question of how we reach people in other places. And your other part is about other countries. We have one unit in Cayman Islands, that is in the Caribbean islands, very close to American border. That is also a very growing unit where I was fortunate again to start neurosurgery services there. So to set up similar kind of, to cater to people in the Caribbean area and from US.
Thank you. Sir. Thank you.